retail outlet for the same dawa, and because what the patient wants is availability of drugs. The whole issue of supply chain is not part of why they're in the hospital. Can we pilot something like that, of not necessarily placement, but you doing retail directly to patients at the price we agree, branded as county in some of these big facilities?
And take SHA or whatever insurance directly. Okay. I want us to raise all the questions so that the ones for meds can then be answered by meds, and the ones for PATH can be answered by PATH. In the interest of time, because we really have to manage time.
Just a very small one.
Yes.
Do you do last mile to facilities? Specifically to facilities and not just to the counties. And now that, and you also get, we are being told that NESP is having a problem, the medical equipment program is having a problem getting payment directly from, is it SHA? Are you mapped up with SHA so that then, if you can be paid directly through SHA?
Are there any questions for PATH?
There's another question over here. Mine is just asking me, is it possible to restructure your payment in such a manner that sometimes counties, money actually really delays, so that if you're going to plan well, at all the time, medicines all over the hospitals. Secondly, I'm supporting Sakaja. Maybe make a route so that it can go direct to the patients by themselves directly. And then thirdly, Sakaja doesn't want you in Nairobi. Why don't you come to Taita Taveta and start your farm over there? I'm inviting you, we have the land, and Taita is away going to Tanzania, is away going to Nairobi, you can even go back to Mombasa.
He's my brother-in-law, so I agree.
Yeah. Thank you, Your Excellency.
Are there any questions for PATH? None. So then, is there
PATH was very clear.
Is there a go-around microphone for?
They didn't even have a PowerPoint presentation.
That's fine. That's fine.
The rest have prepared themselves. That's why we're responding to them.
Yeah.
Next time, come prepared for governors.
Yeah. So thank you, Your Excellency.
Governor Sakaja, you can't rebuke the sponsors. They're not keeping you here.
No. There's no allowance.
Oh, okay.
But when you're presenting to heads of government, you want them to be able to take notes at least on 2-3 things. It's not just a speech.
Please respond.
Like the one for meds, we want even the video to show our CECs. So I'm just encouraging for better preparation next time.
We've had
not rebuking.
Point med, Governor.
And I don't know how much the sponsor.
Meds, please respond. You have a mic there on your desk. Just respond from there to those issues raised by the governors. Thank you.
Yeah, thank you, Your Excellency, and your other excellencies. So we've come as a team, as I said. So I want to give a chance to our head of commercial services to address a number of the questions that have been raised. And I said we also have our members of our board of governors. They'll also field some of the questions from what has been said. Thank you.
Thank you. And also Your Excellencies who are here present and our CEO. Let me start with His Excellency Governor Mwandime. We have been to Taita Taveta. Personally, I've come from Voi Hospital. I've gone to Mwatate, among the other facilities. I've gone to the ground we have supported, and we met in Mombasa when you said in the MOU. I've been supplying to the last mile for all your facilities. So based on that, we have been great partners. The other thing I want to thank you, Governor Sang, Your Excellency. I think in terms of the last mile, we have gone to all the counties. We took to the rural health facilities. Because I can see Kweni, Mutora Junior, I've said from Mwandime, we have done that. Even Nandi, remember, we have been done. Muranga, Governor Kangata Honorable, we have also done the same. I'm trying to give an example that we take to the dispensary in the remotest parts. We do not go to the central stores. We deliver there. And that's why we are saying, please patronize our services, and we are going to not disappoint you, but you'll come there. In terms of affordability and fill rate, we have compared ourselves, and I want Your Excellency Governors who are here present, go and check, when you check from the essential list of KEMSA, and you also compare with men's, we are cheapest with more than 57 products, very cheap. And we have done that. Actually, I was with His Excellency Governor Mutora in Makueni in February. And we compared. And when we went to the website and said, hey, you can attest for men's, you are the cheapest. And not only cheapest, but in terms of quality. We pride ourselves in terms of quality, and you can come for the investment and see what you have done there. So fill rates, 98% is even little. We go to 100%. What we mean, if the stocked items you can give you at 98%, whatever you do not have, we look at it as non-stocked item to ensure we give you 100%. That's why you say we can supply you, maybe you have a back order of 2%, but you deliver the 2% to make it 100%. And the turnaround time, we believe ourselves, we have done some within 1 day, others to 10 days, even to the rural facilities. I've worked with the government. See, the pressure you get from the government, so they say, I need those commodities by tomorrow. Our teams don't even do night duties to ensure that we deliver. The other question was about issues of deposits. Thank you, Your Excellency Governor Sakaja. Let me first start that Nairobi County, and right what you said, I've even held a meeting with your teams who are in charges of the sub-county facilities and even level 2 and 3. And I've been supplying Mamarusi, Mbagathi, Pumwani, among the others, even Dagoretti. Last month, we had a very great meeting with the team, and I agreed with them. Instead of, I can be able, before I wait for Governor Sakaja to sanction, since they have FIF among the others, why can't I supply? So the rural facilities within Nairobi, we have been doing that. We haven't come to Mathare in terms of maybe the calamity you want, but Your Excellency is that CSL, the criteria is when you put, you can team up with all of you in case of any CSL means is ready to commit and come and partner with you. And the support you have given us, it is enormous. But you wanted to say, all the 47 counties, Your Excellencies, we want you to come to us. And one of the things we wanted to do in terms of that is to invite you to MENS, so that when you come to MENS, you come and also appreciate, so that whatever you have the capabilities, so that you're not displaying in terms of a video, come and validate. His Excellency Mutora came and he saw for himself, and I told him, come and speak the same gospel. But thank you for your support. And the last one, in terms of the medical equipment placements, we also do the same strategy. So you'll be doing the facilities directory. What we have done here in terms of our showroom, which you are requesting, all of you, it's just a few. When you come to MENS, it's very massive. We have done a lot of partnerships with CMNs, with Paro from China, among others, Abbott of South Africa. So we watch the placement model, and also you can be able to sell in higher purchase, you pay slowly. Directed to the facility. Yes. To the patients, yeah. We can also do that through the support groups, which I think you have been able to factor some, but you can also explore.
I don't think you've understood my question.
Oh.
Sorry, Chair.
Maybe you can repeat it again.
Let me help you there. I think what the governor is asking is,
Yes.
can you actually come and set up a pharmacy within the facility
Yes.
and take insurance directly and at an agreed price?
Okay.
And with some, what do you call, you wanted it branding for the county, say in Nairobi County government or whatever, sell directly to the patients at an agreed price. That's what he's asking.
Yes, maybe I can take that. Maybe in the video, if you checked, Your Excellency, we talked of having come up with a company called Meds Devan Company Limited. So that is an area that we've realized that there are other people that are not serving well as we should, and they've been knocking on our doors. And that is a company that will help us to reach out to such areas. So there's something that is really within our thinking right now. As we get into next year, we explain, then we expect that we can start dealing with like pharmacies. And as we move on, that is an area and an idea that we've picked and will be part of the implementation. I hope that helps. But it is something, an idea that we're already working on through our Meds Devan Company Limited, which is now going to reach to the non-traditional market segments that we've not been dealing with.
It's the traditional segments, I'm saying.
Okay.
Instead of you selling to me,
Yes.
to then sell to the patient for 4 or 5, and then wait for reimbursement, why don't you come to Mama Lucy, I give you space, run my pharmacy, and sell directly. So that there's no issue of umenilipa, sijakulipa, nini. You just, why not?
We've gotten the idea.
See, tufanye pilot mbili, Mbagathi na Mama Lucy.
Yeah.
You can pilot it in a couple of hospitals in Nairobi.
And you can still claim from SHA.
Yes. So There's never a lack. You see, I won't
Yeah.
have to think about theft of dawa or
Yes.
GBA. I won't think about stores
Yeah.
or lack of it. Because we have created too many bureaucratic
Yeah.
for no reason.
Yes.
What the patient just wants is to be seen by a doctor and to be given dawa.
Yeah.
So can we find
Colleagues,
And,
colleagues,
and you know that it will kill many birds with one stone.
Chair.
You know, right now,
Yes.
actually, there is a lot of safety in medicine. If you're going to do that, you'll mitigate that problem. And at the same time, you know, patients will receive what you are
And,
on right.
Chair, allow me to just, first of all, as your colleague and then as the Chair of Health. The issue that Sakaja has just brought up would be extremely ideal in the absence of whatever it is we're discussing next, and that is the matters to do with SHA. Because the issues to do with SHA, they're already talking about payment, and the hospital is referring to, I believe, you know, if it is Pumwani, it is about delivery. Now, if you have SHA members, and then now you get just a point of caution as those discussions go on. Is different on what their needs are. So maybe we could request kindly, it is clear you have a demand, you're a person in demand. If it is okay, we just go that direction that you had earlier ruled on. But I'm just asking for people to be careful.
think they
Don't
have-
get accused that you're then the facilities are selling, and then now you expose the people from been written there, product not for sale. Just a precaution.
Now, I think they have responded to the questions asked, and on the setting up pharmacies directly. You can explore that with the Nairobi governor for a start,
Yeah.
right?
Yes.
Unless there's something burning, I want to move on.
Chairman, there was one question which you never responded from His Excellency about the deposit. We've got 20 counties we are giving credit so far. The ones we have been able to ask for the deposits or prepayments is when you are starting, maybe you didn't have history of trading county directly with the mains. We profile you. Maybe you do 1 or 2 or 3 trainings. Then once you see that you are able to repay, then we put you on the credits by the board of directors who are sitting here. They normally approve. So a list of 10 has been approved. 3 are going to be approved by the end of December. Yes, in Nairobi, you can put your... Thank you, Your Excellency. And the last one is about a key ask. Chair, will be very brief. Our key asks, and we are saying we want to strengthen our collaboration with all the 47 counties in terms of air products and technologies, equipment, and also system strengthening. We do a lot of trainings of healthcare workers and issues of governance and also issues of strategic plans. Number 2, we also trying to explore collaborative demand planning and consignment stocking. Chairman, you can appreciate whereby we can come to your facilities, put the commodities there, you start using, but we charge you every month based on what you have used. So you invoice you. So at no time you are going to run out of stocks. You have the commodities. Okay. So our field officers will be can be able to be tracking that. So that one we want to pilot with some of the counties, and we see if you can do that. There's no time your patients are going to cry for any commodities. Number 3, we also requesting kindly, because the Council of Governors evaluates their key partners. If we can also have a liaison office to have an FBO representative there, because remember, these men's represent also, we are with the SUPChem, KCCB and JAC. We have a consortium called Kenya Field-Based Health Services Consortium, and we are the secretariat. So we are kindly requesting if you can be given an opportunity to have a liaison office at the CoG, so that any meetings, any deliberations, they can be fast-tracked, real-time and spot-on. The other thing we are also requesting is also restructured debt payments, and that question was coming from the Excellencies Governors when the monies are drained. Means we have opened that window. So do not run away from us in case you want a debt from us. Let us talk. Let's keep you engaging. We can tell you, if you have 10 million, the debt was ABCD, pay this, we supply you this, and we cut this one until we pay that debt. We are also very human, and we want to partner strongly. And the last one, we are also saying, currently, I know the law has been introduced for electronic government procurement, agency. In terms of account for us to be able to register, the law allows us in terms of either we can do manual and also you can be able to do electronically. Please let us support us. We have already started that journey. We are at the treasury in terms of the same request. We are registered trust, which is incorporated, but also allowed in law to transact business with the government. So please, those are our key asks, your chairman and your excellencies, kindly consider us, but we'll continue working with you, strengthening together the systems together, and count us as key partners, complementers of the government. Asante.
Thank you. I think we'll leave it
Chairman,
at that.
Chairman, please allow me.
Now, I really have to move on. Who's putting up? Oh, it's Madam Director.
Yes, Chair.
Yes.
Thank you, Chairman and Excellencies. I thought I'd just make a comment. I'm the only lady on the team and also representing the board to just give our most sincere appreciation for the collaboration and partnership that you've given us. We appreciate the ideas that should indeed inform our strategic moves moving forward. And that is why the board is represented here, so that we can hear what the governors are saying and what we need, areas of improvement, and where we need to make amendments. And we appreciate the new ideas that have come on the floor, and just to say thank you. And we are open to collaborate and grow the partnership. Thank you.
Thank you very much. Thank you. Please, a round of applause for MEDS and PATH. Thank you very much. As for the embedded liaison person, we will look at it. Yeah, you might want to pay for it yourself so that you have your own person in there and you're paying them. But it's a discussion we'll have. Okay?
Yes, and Your Excellency, we have a stand for all Your Excellencies out here with our equipment being displayed.
Yeah.
So during your breaks, please pass by and we can field all the questions that we are not able to field in this room. Thank you.
Thank you. Now, Governor Sharif, as you come up, also, probably, in addition to all the things I've said about SHA and UHC, I hope Mary and team will also be updated on where we are on NESP, how many pieces of equipment have been delivered to where, what percentage of delivery we are at, and whether we're actually able to pay for the services being offered under NESP. I thank you. Karibu, Governor.
Chair, one more ask. I sit with Director Gerald Mashari representing CoG at the SHA board, where I represent his brothers here, the faith-based. I request to sit through the discussion just to pick your issues, if that is okay.
Governor Mutula, are you okay with that? Because you're the one who had suggested that we out them.
She's sitting here on behalf of SHA, so she's welcome.
I'm here for MEDS, but also I represent MEDS on the board of SHA.
Yeah, because honestly, of all the issues that the reason why we're raising these issues is because we want SHA to work. So if you are SHA board members, I think you will gain a lot by sitting in, and will also gain a lot by hearing from you why we keep raising things and we don't get answers. I think we should allow her to stay. Yeah, thank you very much.
Thank you,
Governor Karibu.
Excellencies.
That's my file. That's your file. Sorry, that's mine as well. What was mine? You didn't come with anything. The chair is carrying all my documents. The governor of Nairobi. Are we all here? Can I begin? Good. Thank you very much. Colleagues, we had a meeting, inaugural meeting on 6th of November. Initially, the plan was that after the health committee meeting, we were to actually meet the teams from the ministry and SHA, but then after further guidance, we agreed that let's consolidate every issues into one comprehensive document because health is something that's affecting each and every one of us. And I wish to present what are the issues that we had discussed about. One was the issue of delays in disbursements. By the time of this document being prepared, the amount of money that had been claimed by all our facilities, that means the 47 counties in total, was 25.5 billion. The amounts that had been applied for payment is 18.7, and what has actually been paid is 15 billion. Now, you see the difference between 15 to the 18.7, and there's even another difference between the 15 to 25.7. There's two issues that are here. One is delays in payments. Two, none of us has an access to actually confirm, has something been rejected? Then please take note of this, and I'm hoping that this will be a resolution by ourselves. It is very vital that SHA, and the directors are here. I'm only seeing one, the other I think, I'm only seeing Gerald, the other lady, I think she's escorting her colleague. Oh, yeah. One of the issues that is actually being raised by governors is if something is rejected, right now there is no follow-up mechanism. That means there's no appeal. So we are now dependent solely on one person to make a decision, or maybe it's a team of people who make a decision. And if that is going to be the case, then at any given time, let's say collections are very, very low on a specific month, Exchequer has not come in for public health, or whatever reason that may be, if a rejection is going to be done across the board, then there's no way of us being able to appeal any of this. Constitutionally itself, it's wrong. Anything cannot be final. There has to be an appeal mechanism that is going to be there. Two, there was the issue of visibility. And I had requested Mary yesterday, if we could be able to, maybe after I present, we can try and see one or two governors can be able to use their login credentials, and we try and see whether the portal that they have offered is actually working or not. It's working? Well, I was proposing that we actually project it. So in the interest of all of us being here, Sakaja says it is working. I have not been able to do mine, but it is always good we make a decision together that it is working, or if it needs improvement or whatever else. There's something else that is also coming out quite clearly here, and SHA started from October last year. Today, we're in November, about to cross into December. By the time summit will be there, we will be 14 months into SHA's existence. Chair, it is important for us to be able to agree on a reconciliation mechanism. Because in your books, even when you're doing your audits, it will be known that there's money that has to be paid. When SHA is going to be audited, we do not know whether they're going to say that they rejected. We do not know whether they're saying that this is something that they're still querying. And even in the process of that, I think it is equally important that everything needs to have a shelf life. If you are talking about asking for extra documents, it is only right that they tell you, we're asking for these documents. That means, by the way, this is best practice of medical insurance everywhere, where if they need extra documentation, they need to ask for that extra documentation within a certain stipulated time frame. Two, if they're saying that we have rejected, they need to give you reasons as to why they're rejecting within a certain stipulated time frame. And most important, they need to be able to agree that we have a time frame for us to be able to appeal. And if we are appealing, who is looking at this appeal as well? Colleagues, I just want you to realize the magnitude of this whole thing. The amounts of money that we had been debating and pushing the Senate and the National Assembly, I think the last time the difference was about 4 billion, then it went up to about 10 billion. This is what we have actually been pushing for it to be as part of equitable share. The difference in what we have been paid vis-a-vis what we have claimed is a difference of 10 billion shillings. Maybe just to give the magnitude of what it is that we are actually looking at. It's 10 billion. Now, it might sound small because this 10 billion, Mombasa's shares is divided into 47 facilities plus. Kiambu would be shared into 100 plus facilities. I'm assuming something similar for Nairobi and the rest. So when you look at it, it might look as minute as 20,000 or 30,000 for a certain facility in Mombasa. But when you look at the cumulative figure, this is what we have all been pushing for in terms of equitable share. The net result of this, we've just had presentations from MEDS. And one of the issues that one of the governors has been talking about is to be allowed a credit line facility. That credit line facility will cease to exist if you're not going to be paid. Even if today you want to discuss and negotiate with your financial institutions on a way for them to be able just to give an undertaking to MEDS or KEMSA or any other supplier, if they're going to see that there's going to be a problem in payments, they will cease. There's an issue that was discussed here, and I just overheard the chair talk about. I don't know why it was not even put into the main agenda today, and that is the issue of NESP. The issue of NESP is, I think right now we are on what? 7 to 10% of equipment has been supplied. Nairobi, in their own wisdom, did not sign. The last time I checked, Nairobi did not sign. But for those that signed, we're about 7 to 10% uptake. For those that have already supplied, they have not formally presented this to me, but for those that have already supplied, some of them are actually claiming that from the date they've supplied till today,